Joining us live via Skype to do a comparison of approaches to lockdown in Nigeria and the UK is Dr. Charles Omole, international lawyer and political strategist. Thank you, Doctor, for joining us this morning.
Thank you. Good morning. Thanks for having me.
Great. Now, by way of comparison, we seem to be recording more cases currently in Nigeria, with the recent one being 245. What would you say the government is not getting right or doing right back home right here in Nigeria before we come to the UK?
Well, I mean, to make it clear, I mean, the government is between a rock and a hard place here in terms of decision, to make in terms of whether to lift the lockdown or not. But when I was doing some research about this, the key lesson I feel the government can learn in Nigeria very quickly is if you look at the case of Ebola, when we have few years back, when we had Ebola ravaging many countries in West Africa, the number one thing that bore down, that allowed Ebola to be conquered in those countries was massive sensitization and reorientation of the communities. Because what was happening during Ebola was that people were hiding their sick family members because they didn't trust the system, or all kinds of rumors were going on as to what was going on. Some did not believe Ebola existed. So a massive community information campaign started. A lot more people began to be open about it, and that was what allowed Ebola to be conquered. Same thing is happening here in terms of COVID-19. You have lots of people, some don't believe COVID-19 exists, some do believe it exists, some don't trust the government, all kinds of issues going on. And I would say in this regard, Lagos state government is doing something right here in terms of their mass information and sensitization, but Nigeria as a whole, I don't think the federal government is doing sufficiently in terms of that area. All you have to do is look at Kano and the north, and you can see what misinformation, what damage that can and will do now that the lockdown has been lifted.
It seems to me the UK government seems hesitant to commit to a date that concerns the easing of lockdown restrictions and eventually phasing out of the lockdown. What are the key considerations?
Well, I mean, in terms of the UK government, they feel they still have some time, because what's happened is if you are an employee in the UK or if you are self-employed, government has made financial provisions to pay those people 80% of what they would normally earn till the end of June. So as far as government of the UK is concerned, they are paying you to stay at home till the end of June. So they are not in a hurry, so to speak, in that sense, because financially they are already committed to meeting people's financial needs till the end of June. So that's the window they feel they have to act. And the difference also here is the fact that the cases of COVID-19 is now being more controlled in the United Kingdom, in terms of the loss of hospital facilities, additional facilities, and bed spaces that were created that are not being used at all, because the projection in terms of number of infection has not materialized. So the lockdown lockdown work as a system when majority of the people obeyed. So in all the countries worldwide where lockdown worked, people have more or less been incentivized financially to stay at home. In all of Africa, lockdown hasn't worked. The problem we're having in Nigeria, we have it in Kenya, we have it in South Africa, we have it, in many other places across Africa where poverty is strong. So poverty, makes people to make a decision between surviving, in terms of, having food to eat, or a possible COVID infection, and people will choose to survive regardless of the risk involved.
Now, still on the UK, with the large numbers of deaths experienced in the UK, how is the NHS coping with this burden?
Well, I mean, that's the good thing that the lockdown has done in terms of helping the NHS to reduce so that NHS was not overloaded. The whole idea of, one of the objectives, which is of the lockdown, was to reduce the cases so that the NHS is not overloaded. But I must say this, though. The reason why the NHS has not been overloaded so far is because all non-urgent medical conditions, cancer screening, several other things have been postponed for months. So NHS is now more or less dealing with mainly COVID-19 cases and other emergency life-threatening conditions. So, but there are so many other ailments that are not being treated at the moment, which of course is a problem because it means once the lockdown is down, NHS will still have a problem because they will, at that time, they will be dealing with both COVID-19 cases, even though on a reduced basis, as well as the deluge of other medical conditions that have not, that they've kept, at bay for the past several weeks.
Now, still by way of comparison between the UK and Nigeria, you did mention while you were speaking how UK citizens were incentivized by the government. What do you think the Nigerian government could take away from that?
Well, I mean, one thing is that you cannot quarantine inequality. Nigerian government need to understand that, I was reading somewhere, yesterday that some Nigerians actually, some Nigerian minority don't really care much about COVID because they feel it's a rich man's disease because mainly all the names they've been hearing of people who have been dying from it are in quote prominent people. So more or less, some Nigerians are seen as karma that, okay, all these rich people, let's COVID take them. But they don't understand that COVID doesn't discriminate in that sense. So one of the key lessons, I think the point here is Nigerian government needs to understand that there's so many, caring for the people and trust deficit between government and Nigerians is a major problem. You see, if the people don't trust the government, a lot of things will happen that people will, take, their lives into their hands. So there are all kinds of issues around, COVID-19 that makes Nigerians not to trust the government. Some of them are historical, so COVID-19 is just exemplifying it. So number one thing is massive information campaign. Number two, a more people-oriented governance needs to be instituted in Nigeria. I mean, it doesn't help that all our prominent people in Nigeria, anytime they are, I'm talking of politicians now, anytime they have any minor ailment, they fly out of the country. So they are telling Nigerians, your healthcare system here is not good enough for me. So if it's not good enough for you, why should it be good enough for us? So there's a lot of grounds that I think the government of Nigeria needs to make up in increasing the trust between Nigerians and the government.
All right, finally, Doctor, what is the strategy from the medical point of view towards containment and management of infected people, and also in the UK, and draw the comparison right here home in Nigeria?
Well, I mean, the key thing is that in the UK, the government has ramped up testing, so there's a lot more testing now. And I think in Nigeria, part of what needs to happen is not only do we need to have more testing, we need to have speedy testing. Taking people's samples and not getting back to them until several days later is not good enough. We need to have rapid testing and rapid results. A lot of the things that is done here cannot effectively be done in Nigeria. I mean, social distancing, as people say, is a difficult thing, not just in Nigeria, in the whole of Africa. So that is the key thing we need to bear in mind, about this.
All right, Doctor, it's been a pleasure having you join us in News on the Hour, and thank you very much for your time.
Thank you very much.